Welcome to the New Dentist Study Club podcast. My name is Dr. Sanj Mohanta. Listen in to learn about clinical tips, practice management, and also emotional management so you can become a better and happier dentist. Let's go. Welcome to the New Dentist Study Club. My name is Dr. Sanj Mohanta. And we're here with Dr. Nick Sharma, who's going to teach us some tips in pediatric dentistry. Welcome, Nick.
Thank you for having me. Welcome.
Now, I met Nick online a few years ago. That actually sounds really bad. People are going to be like, what? Is Sanj unhinged? It's like, no, I met Nick online because during the pandemic, you provided like free dental webinars. And I remember I loved how you talked about telling kids a story to help with behavior management. So I'd love to hear like a typical story you would say. But first, I want to hear your story, Nick. So tell us about yourself.
All right. So first of all, thank you again for having me on this. I'm definitely honored to be part of this process. And we did meet, a while ago, and we're finally kind of, doing things together. So I'm happy to do this. My journey, it started in Montreal. So I'm born and raised in Montreal. Spent my whole life there, did dental school at McGill, and then realized towards the end of dental school that I wanted to work with kids. I just wasn't 100% convinced. I was like, oh, I still want to do some crowns. I still want to do some root canals here and there. Maybe a family dentist would be the best option for me. But I was good with kids. I guess just, my maybe goofiness, my patience, my conversations with them. And I realized that a lot of my staff and faculty noticed that. So they started kind of plugging in once in a while, like, if you don't do pediatrics, you're wasting your skills. If you don't do pediatrics, you're wasting your skills. So it just kept repeating in my head. I'm like, you know what? Let me just do a pediatric GPR. And if I really love it, I'll continue to do pediatrics. If I don't, then I know family dentistry might be the best balance. So I went to do a pediatric GPR at the Montreal Children's Hospital, which is also under McGill. So it was a one-year program. And honestly, within the first month and a half, I got bit, I got kicked, I got smacked, I got peed on, I got thrown up on. Yeah, so I got the whole package within the first month and
And
a
you were
half.
like, I love this.
And that's when I thought to myself, I'm like, you know what? Deadlines for pediatric applications are 2 months away. I got to make a decision soon. So if this is as bad as it's gonna get, it's not so bad. So I think that was the switch where I was like, you know what? It's a great feeling rewarding wise, like when you're done that procedure, because you know how hard that procedure is. I mean, every dentist knows how hard some pediatric procedures and appointments can be. And the whole time your heart rate is at its peak, and then when you're done, you're like, oh my God, I just did that. This is amazing. And that satisfaction and seeing that child, leave somewhat happy, parents relieved, that the procedure is done, was just kind of reading that room was a good feeling. And I was like, you know what, maybe I could do this for the rest of my life. So I applied into a pediatric program, got in. I went to University of Rochester in New York and did my 2-year certificate there. And that's how I finished pediatrics. And then I went back to Montreal, where it kind of just happened, where things fell into place. I wasn't really looking for a academic position. I was looking for private practice. I had a pediatric dentist that I had spoken to when I was in dental school, and he said, whenever you're done pediatrics, come back. I'll have work for you. So I went back to him. He's like, yeah, we can do part-time, we can do full-time. I was like, let me start with part-time and let me look for another, office. And I decided to visit the Montreal Children's Hospital just to see the old team again, where it all started, where the dream began. And they offered me residency program director. So
Wow.
they just happened to be looking for a program director at that time. I walked in. They, I guess, may have liked my experience with them. And yeah, it was offered to me. So I did part-time residency director and part-time private practice. And that's how I ended up in Montreal.
And now you're killing it in Toronto. We're glad that
Yeah.
you're here now.
And that
And
was another phase.
and I remember when you were doing those pediatric webinars during the pandemic, you said that one of the ways that you do behavior management with kids is you tell them a story.
Yeah.
So now, pretend I'm 6-year-old Sanj, chubby
Yep.
Sanj, who loves cookies, loves
Yeah.
animals. What story are you gonna tell me? Because I'm crying in the chair while you're trying to do a pulpotomy.
Yeah. So the first, I mean, the first thing is the tip that I give to like all my friends that are general dentists is I say, whenever you're about to do the toughest part of the procedure, don't stop talking. So a lot of people, because of the stress and anxiety, you're so focused on that procedure. Once you get comfortable with the actual procedure, all you have to focus on is talking, because a pulpotomy is not hard. A stainless steel crown is not
Yeah.
hard after a few practices, but it's the, like you said, crying cooperation part. So it all starts off with a story. So I start a story from the minute they sit in the chair. And I think the most common story I used to use was I used to use the rubber dam a lot for kids before. And it started off by, the topical being the jelly. We're about to go to a birthday party. There's going to be trampolines, there's going to be birthday hats, there's going to be princess rings, there's going to be princess crowns, all
Oh,
kinds of things, just to
really?
kind of, set the environment. So I start with the jelly at being, the jam that we're all having on our toast. It might be a little hot, it might be a little spicy. Let me know, I'll wash it off. So we kind of work our way up, and then the clamp being the princess ring. So I always try the princess ring on their finger. And you just put the loop of the clamp on their finger, and you show them that, this is what I'm going to be putting on your tooth, and they don't feel it because it's obviously loose. And when I put it onto their actual tooth, they won't be feeling that either. So the anesthesia part is a little bit tricky, and I think that's the hardest part. So for me, it was always using that, there was a lot of bugs and flies at the birthday party. So there's mosquitoes everywhere. Let me just catch those mosquitoes before they bite you. And sometimes I would start whispering because I'm like, I'm getting close. I'm about to catch this one. Don't move. And that whispering would
Oh,
just get that kid's, attention to my story rather than, anything else that they're feeling, they're tasting in their mouth. And then literally the minute I sting them with that, the needle, I would say, oh my God, the bug just caught your cheek. Don't move, don't move. I got it. I'm going to twist it out of there. And then I just they can feel it. I know they can feel the little pinch, but that pinch is just the mosquito that I'm going to be taking out. And I took it out. And now they're like, oh yeah, I don't feel the pinch anymore. And now we get out of the mouth. The anesthesia part is done. And
right.
that's when I started introducing the, rubber dam as the trampoline. We're all bouncing around, we're all jumping. It's a beautiful summer day at a birthday party. We're gonna have cake. You just keep going. You're just adding more components to the story, which probably was a birthday party I went to as a kid, right? So I'm
Yeah.
just describing that. And some people used to do, camping tents. So I went camping on the weekend. Let me tell you what I did. There was a mosquito. Like I would still just modify the story,
Oh,
but
that's
have the same
great.
components. Yeah.
Oh, I love that. And you also do a lot of countdowns with kids, right?
Yes. Yes. I think countdown is one of my favorite techniques because it makes a child feel like we're almost done. So I always count down from 5 to 1, depending on the procedure. I'll go at different speeds. If you're using the slow speed and you just need, the vibrations is bothering the child and you need those last 3 seconds, 5 seconds, whatever it may be, that's where I count down. I say 5, 4, 3, 2, 1. And you have to always follow that with a reward. So whether it's a break, whether it's, we're going to change the show on the TV, or you're going to get an extra token if you do these 5 seconds, you have to reward their effort to finish those 5 seconds, because then that'll allow you to go back and do it again for another 5 seconds. So just doing those in little countdowns can get you through 2 minutes of a treatment, but you just did 5 seconds times X amount.
I do the countdown too. Like even when I'm giving local anesthetic, I'm gonna be like,
Yeah.
okay, I'm gonna count to 10, it'll be over.
Yeah.
And then they realize, okay, I can do this for 10. And
Yeah.
then, like you said, stay true to your word. Like if you say I'm gonna do this for 5 seconds and stop and
Yes.
give you a break, you have to do it.
Yes. Yes. If anything, like stop sooner, but don't take longer, because they're
Yeah.
gonna remember that. They're gonna that
That's how you
trust
build
has to be built.
trust.
Yeah.
Yeah. And I
Has to
love
be.
the story.
Yeah.
Like
The stories, I mean,
I'm gonna
you
start
probably
hiring you for like kids' birthdays. You're awesome.
I think that's the biggest thing about pediatrics is you talk so much. And that's one of the things that most pediatric dentists say is that, when we finish work, sometimes I'm on my car ride home, I just have music on and I'm just driving. Sometimes like I don't want to be on a phone call because you've just spent your whole day talking, that you need that 30 minutes of, downtime, and then I'm ready to go. So there are special personalities that, treat kids. Talking is one of them. You just have to be ready to talk a lot.
Now you
Yeah.
mentioned that you don't use rubber dam anymore. So what do
Anymore.
you use?
No. I use a dry shield. So it's like a bite block, a suction, and a tongue retractor, cheek retractor all in one. There is Isolite out there that also has a light in there. I don't have the one
Oh,
with the light, but I do have the other four features. And to be honest, for the right case, right patients, you can use those and kind of creates a little protection for the tongue, cheek, all that stuff. The saliva is getting suctioned up. My assistant is more free and able to just kind of be more efficient at passing instruments and mixing stuff that, it just, I think it's definitely something that everyone should look into, at least when they're treating kids, because it makes a huge difference. The only downside is that it is a little bit big and bulky. So the gag sometimes kicks in, but that's where you either drop down in sizes or add some laughing gas to your procedure.
okay. So tell a story, you count down, you're talking the whole time. Any other tricks
Yes,
for behavior
lots.
management? Okay.
Got lots. One of the other things is, like I was saying in the story, is the voice control. So
Okay.
changing the tone and the pitch and the rhythm of your voice plays way more effect than we think. That quiet, suspicious part of the story just adds more to it when you're changing your voice. If you just have that monotone voice, the child will, I mean, if they fall asleep, that's not the most, worst thing that could happen, but it is definitely, more just distracting. So the next technique is distraction, right? There's all kinds of ways you can distract. Now, the good thing about current times is TVs are in most offices. We have a TV in our ceiling, so that just makes it so much easier. The child is always looking up. I try to comment on the show, so they're paying attention to the show. That's a distraction technique. You could also use headphones to have music. My stories are a distraction technique. The other thing is guided imagery. So you're distracting them by telling them what to see and what to
Mm.
feel. So I used to use my first bike ride as one of the stories that I would use. And I would play, it's a beautiful sunny day. They're kind of visualizing this. I just got a brand new bike. It's blue, it's shiny, it's got a little honk on the front end. And
Yeah.
then I would say it's a little bit windy when I'm, riding it, but I'm trying to pick up speed. And I would use the air water in their hair just to
Oh
air their hair, and they're feeling the wind. And to be honest, some kids would be super into it. And
my
you
gosh, it's a 4D experience with
yeah,
Nick and Sharma. That's
it's a under, yeah, exactly. It's an under budgeted 4D experience. But
start
yeah,
writing children's books. That's
you just
awesome.
get them involved as well. Like that's the other thing. The hard part about dentistry is you can't have a full out conversation, and I don't want my
Yeah.
child to be having a full out conversation. But there are things you could do with thumbs up, thumbs down, yes, no,
Okay.
and I would just stick to yes, no type of conversations throughout the procedure. But I would tell them to just show me with their thumb up, thumb down. So obviously the older children would get involved, and I would say, did you have a first bike when you were 6 years old, or like and they'll give me a thumbs up. Oh, was it blue? Was it red? Let me guess the color,
Oh,
and then
great.
they're kind of involved in the story. They're focused on that answer, not actually the drill that they're feeling while I'm doing it. Like I said, getting the procedure down is the first step, but to get them through the procedure is the second step. So being confident enough where you're efficiently doing the procedure. Like I'm not even thinking about what's my 1 millimeter prep, this, that. No,
Yeah.
because I've done it so many times, I'm confident with the procedure that the procedures are not hard. It's just getting the procedure done.
So this has happened to me a few times
Yeah.
where, I'm getting through the procedure and all of this, things are going well. And all of a sudden the kid loses it. It
Yeah.
starts crying. You've already prepped the tooth. It's open. Now what do you do?
Yeah, so I mean, it happens to all of us. It happens to pediatric dentists as well. We're not magicians, unfortunately, but sometimes you just can't finish. You can't finish what you plan to do.
Mhm.
But that's where having a backup plan when I start, from the minute that child sits in the chair, I already have a second plan.
Okay.
And it kind of sucks to say that I'm being negative, but no, it's just I'm being prepared. So for me, it's like if I know I have to do a composite and I'm gonna have to etch, bond, and put a matrix and all that,
Yeah.
and I won't even get past the etch point, then I have glass ionomers, resin modified glass ionomers ready to go that are a little bit moisture insensitive, and I can quickly finish up, at least plug it and
Good.
then figure out the next plan, right? So there are times where you have to abort. You can't do the procedure, you can't complete it, but having a game plan and having alternative routes like on your GPS is always a good plan. You gotta foresee every situation.
Oh, that's
You're the
great.
pilot.
Now, okay, here's the question. Parents in the operatory or out?
Ooh, that's a hard one. I'm honestly, I read the situation. Okay, so I've been practicing for about 11 years now, and I've seen it all where parents used to be great, like in the sense that I would really not mind them in the operatory. I just think parenting styles have changed, thinking has changed, expectations and parents' strength, mental strength towards their child and their procedures have also changed, right? So for me, I try to read the parents on the day of the consultation. That's really when I make the decision for all future treatments. And if that parent is adding to my behavior management skill and success, then I will keep them in the room, but I will set right away the limits where I say, hey, you're going to be present in the room. I just want you to know that I need you to help me rather than work against
Yeah.
me. And a lot of kids, I always say kids will use their parents as escapes. They know that if they cry and they hold that hand, their parent might say stop. Right. So
Oh,
for me, it's like you can be in the room, but you got to keep your distance from the chair. You can talk out loud and motivate and positive reinforcement and all that. But you gotta let me work with your child, because not only will that make that treatment successful, but it's also setting your child up for independence. They're going to be able to do other procedures. They're going to be able to do other things in life where they don't have mommy's hand to
yes,
hold. Again, depends on age, depends on cooperation, depends on
yes,
past experiences. Are they traumatized? Was
yes.
there something in their past experience that affected them? Then I want the parents in the room. But yeah, I always set the grounds, the first consultation, the rules are set, the conversation is
Yes.
had, and I try to gain the parents' trust just as much as I gain the child's trust on that first visit. So I want to come off as I know what I'm doing. I got this game plan. I like your kid. We're going to work together. We're kind of joking around already. I'm already doing the behavior management, even on a cooperative patient during a consultation, right? So the parent can see, okay, this person's really taking the time, the effort. I feel good. I feel at ease. So I want them to feel at ease so that they can sit in the waiting room and not worry, right? And that
Yeah.
they will be more open to the idea of not being in the room. But I'm okay with either, to be honest. Sometimes it helps when they're in the room, because if the case is not going well,
Mhm.
I can also say, look, this is how your child was. We can't do 3 other appointments
Yeah.
like this.
And they totally get it because they
Yeah,
can see the child's
yeah,
uncooperative. Yeah,
yeah,
I do the exact same thing, Nick. I love how
mm,
you like set the expectations. You're like, this is where you're gonna sit. They can see you're confident, that
yeah,
the kid likes you. The kid can see that the parent likes you. So they obviously get your trust and
yes,
they know what their role is to be a cheerleader and, hold the kid's hand where they're gonna let you do the talking. And I'm sure
yeah,
the parents are as enraptured with your stories as the kids are.
yeah. That's it. And sometimes I hear them giggling in the corner, and I'm like, and I look at them and I'm like, no, it's not real. Like, I'm like, sorry, that wasn't true, but or sometimes they'll ask me questions. Even I've had some parents says like, was there really a fly in there? Was there really a bug? And I'm like, no, sugar bugs are not actual bugs, but yeah, no, good question. So they've gotten involved in the story as well sometimes.
Now, I know we use the same technique with kids where we're just giving positive reinforcement all the time. Like we're not telling the kids, stop moving. Instead, we're saying things like, I like it
Yeah.
how you're holding still. So tell us more about that.
Yeah, yeah. So I always say, saying no to everything does not set the right behavior. Like if I tell you don't sit down, don't stand up, don't walk around, don't do, like you don't
Yeah,
know what to do. The child is going to be
exactly.
confused. I know everything not to do, but what am I supposed
Yeah,
so yeah, like you said, positive reinforcement, that's how it plays. You do a negative, but then you also tell them, this is what I want you to do. And when they do it, you remind them, hey, good job. Whether it's a pat on
yeah,
the shoulder, whether it's a compliment through words, whether it's a break as a reward that you're giving them, like,
yeah,
hey, we're gonna take a few seconds because you did a really good job. Now they know if I want this compliment again, this prize again, this
yeah,
tap on the shoulder again, I need to do that behavior. So I'm just gonna keep doing that behavior. So kids really rely on our, comments. They
yeah.
they really want to impress us. They really want to impress
Totally.
their parents. So showing them the right path is equally important as telling them not to go on the wrong path, right? So you
Yeah.
can't just say no, 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 stop, 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 don't do this, don't do that. No, you gotta tell them a little more than that. Yeah.
Yeah, I noticed that when the kids are closing down, I'll say things like, "I really like it when when you open up really big," and then they open up bigger than they even did before.
Yep.
Yes, like you said, they
Yep.
want to impress you.
Yeah, they do. And then that's it. Like you said, they open bigger than what they did before because now they're like, okay, well, I know what to do to make her happy.
Yeah.
I'm gonna do it even better. I'm gonna show off, you know, and that's exactly what I want. Show off, go, do more, you know. You can do 5 seconds, let's try six. No other child did six today, you know. You could be the first kid that
Oh,
does,
yeah.
and that's how you get that extra second. And then yeah.
Oh, that's good. Oh, great techniques, Nick.
Yeah.
Now, not everything always goes well. So
No.
tell us about a situation where things didn't go well and how you handled it.
Oh God. There's lots. You know, in pediatrics, like your day can be really, ups and downs.
Yeah,
So you'll have that, up where you're like, oh my God, I just completed the hardest procedure. The patient that I thought was going to be the worst of the day went super well. But then there's also moments where you're like, oh my God, just putting that fluoride varnish was a nightmare, and definitely, you have to be ready for it all. So first thing is when it comes to how do you handle negative or failed situations is it could always be worse. That's what I say about everything in life is that it could always be worse. So one of the things I remember, or I'll never forget, because I think this is every dentist's fear, every pediatric dentist's fear for sure, is when a tooth goes back in. So now it's
yeah.
gone somewhere in the throat, right?
Happened
I
to
was a
me.
resident. Pardon me?
It's happened to me
Yeah,
several
yeah,
times.
exactly. Exactly. And then that first time that it happens, you never forget it. It's literally in your memory. So I had it happen to me when I was a resident. So, I was brand new out of school and it was over something. Now that I look back, the stupidest decision that I made at least was it was a loose baby tooth in the front on
Yeah,
a 5.5-year-old. Who was super uncooperative, never really cooperated for dental treatment. So in the first place, like when you have a loose front tooth on the bottom and parents just want it out because they're like, oh, he's complaining when he eats.
yeah.
It's not an infection, it's not a cavity, it's not an emergency, is what I say.
Exactly.
Right. So for me, it's like back then I didn't know. I was like, okay, this child came in, I gotta do something, and I
Yeah,
kind of got pushed by the parents to go down that road. Now we have two parents holding this child. I'm only putting topical and I haven't even given Lido yet. Then I'm
yeah,
giving Lido, and this kid is going nuts. The parents are like on top of him. Like there's just so much going on. And as a resident, I'm like, I just need to get that tooth out. Now, I did everything that I thought I could do to protect that tooth from knocking back. So I had my 2x2 as my screen right behind the tooth. I had my finger support. I grabbed, obviously, it's a loose tooth. So the minute I grabbed it, it's starting to come out, and this kid jerks his head back.
yeah,
So the tooth is gone. It's not in my forceps, it's not in my gauze. And I'm like looking on the floor. I'm like, where is it? And then he closes and now he kind of I don't remember if he did a little swallow, but like there's a little pause. So I'm like, now I don't know where that tooth is. Like he didn't cough, which is a good sign. I'm like, all right, at least like that's a good
yeah,
reassurance for me for a second. But as a resident, I'm like, it's in the lungs. That's the first thing that comes to your mind is I'm like freaking out. I'm like, I don't know where the tooth is. I need the tooth in my hand. I need the tooth in my eyes. I need it somewhere.
yeah,
So, anyways, we sit this kid up. Parents are just happy it's done. Then I have to break it to them that, hey, I don't have the tooth and I don't know where it is. It could be in their throat. It could be he's talking. So we're like, okay, at least we know he's not choking on it.
yeah,
And we're having that conversation. And while we're having that conversation, the mom seemed somewhat okay, somewhat reasonable because she saw obviously the scenario that was going on. Um, the next step was for me to take the precautions. I wasn't even thinking about stress or, my residency or am I in trouble or whatnot, but I'm just saying, okay, what's the next step? Chest x-ray. So luckily I'm at a hospital. We
yeah,
send him over to the chest x-ray. We get the chest x-ray done, but this whole time you're just waiting for the results. You're just waiting for the results. You're just waiting for the results. And then you get the phone call and chest is clear, lungs are clear. Um, Now it's like, do you want us to take a deeper x-ray? I'm like, yeah, go for it. So they take a deeper x-ray, it's in the stomach, and finally, good. I can have the conversation of it's gonna pass. Don't worry about it. This, but that was my lesson, right? Like, I
yeah.
don't do elective procedures on uncooperative children. Like,
Good.
it's not an emergency. It's not an emergency, and it's not necessary. And it could have gone completely south.
Yeah,
And then I would have definitely never done it, but I don't want to wait till it goes that way in order to make my decision of never doing those types of procedures, right? So you try. And if you
yeah,
see that it's getting out of control, now I know, okay, well, Mom, this is not going to happen and it's not necessary. This tooth will fall out. Give them carrots, bite on an apple, do something, but it is what it is, you know.
Yeah, and don't let the parents push you because recently I had a parent who said, "We're not leaving until she gets her tooth taken out." And again, it was an elective procedure, just a loose tooth.
There you
And
go.
the kid's crying. She said about 20 times, "I'm not going to do it. I'm not going to do it." And I told the mom, I said, "She said no, so I'm not going to do it."
Yeah.
And the mom wouldn't leave the operatory. So
Yeah.
I left.
Yeah. And you know what?
And then
You
the
have
mom realized, okay, she's not doing it. And she walked out with
good.
the kid.
Good. You know, you have like obviously the years of experience, the confidence. My biggest tip to like new grads and new dentists is exactly that. That's the hard part. That's the biggest struggle is that your experience and your confidence hasn't gone to that level yet where you can walk out of the operatory or you can put your foot down and say, no, I'm not doing this.
Yeah.
When you're first starting off, it's kind of like you're questioning yourself, should I be doing this? Will other
Yeah.
dentists do this? Like, am I just seeming incompetent? And I tell parents now too, like if they're like, you know what, this kid needs a pulp treatment on a adult tooth, I'm like, you know what, it might turn into a root canal. I'm not comfortable with that. I just tell them straight up, I'm like, if this was my kid, I would not be doing the root canal. So why would I do it on your kid? You know, if
Good.
this was my tooth, I wouldn't do my own root canal. So why would you want a subpar treatment from me? I'm referring you to a specialist who's going to do it the best they can, is
Mm,
who I would take my kid to, is who I would take myself to. And
good.
then they're like, oh, he's admitting he's not good enough to do
Yeah.
this. And they happily go to the other place, right? So I'm like, now I'm not going to try to be, oh, yeah, I can try, you know, no,
Yeah.
because when I'm going to try and it fails, that's when it's going to go all south, right? So,
Exactly. I like how you're being really honest. And even if
yeah.
it wasn't a loose baby tooth, even if it was like a big
Yes.
cavity and it's sensitive, I would still say no.
Yep.
Child's not
Yep.
cooperative. I can refer to a specialist who can do sedation. So
There you
always
go.
do the right thing.
There is an alternative option. Like, you know, there's always alternative options. It's just sometimes don't get pushed into doing one, something that you're not competent for. And two is something that can be a risk, right? At the end of the day. And something you don't believe in. If it's not with your philosophy, it's not aligned with your training and your experience, don't get pushed into doing it. You don't need to. You can nicely say, hey, this is not what I do on a regular basis. This is not something that my principles align with, but I want
Okay.
you to be comfortable with your decision for the treatment. So let's find you another office for a second opinion. I've referred a patient to a pediatric office when I am a pediatric dentist because
Ah,
I've told them, I'm like, listen, our philosophies are not aligning. This is something that I've never done in my 11 years of dentistry, and I won't ever do it. So, but I also don't want you to be forced by my philosophy into doing this. I want you to be 100% on board or not on board at all. So I'll find you a pediatric office in your neighborhood, in your area, and you can go there. And if you like their approach, go for it. No offense, no hard feelings. But if you don't like it and you do agree with what I'm suggesting, you're more than welcome to come back. We'll book you an appointment. I'll get the treatment done.
oh, that's good. I like that. And like you said, it comes with confidence. Because when I
Yeah.
was a new dentist, I just wanted to try things. Like we didn't have a
Yeah.
lot of experience with kids in dental school, so it's like, okay,
No.
let me just try it. And I was always scared of, when treating primary teeth to hit the pulp because our pulps are so big.
Yeah.
And
Yeah.
also, if I did have to do a pulpotomy, I'm like, oh my gosh, I'm so scared about doing the crown. So
Yeah.
could you
Yeah.
give me
Yeah.
some tips on pulpotomies and stainless
Yeah.
steel crowns?
Yeah, for sure. I mean, so I actually made a reel on this and I'm gonna post it soon, but I said it's something that I've never done and I probably will never do is, and I hope I don't get hated on this, but I would never put a composite over a pulpotomy, right? So it's
Awesome.
something
I never do that either. Good.
something
Thanks for
good,
saying
perfect,
that.
awesome. I know there are dentists out there that do it, and to be honest, no judgment pass, nothing against them. It's just something that I've learned about, I've read about, I've never done one, and I probably never will because I can confidently do a stainless steel crown faster than a white filling.
Yep.
So for me, it's like, but yeah, no, pulpotomies. Diagnosis is the most important part. So if
Okay.
you want success, it's that selection process. It's not that your pulpotomy is not good enough and that's why the tooth is failing. It's because your diagnosis was not right. So looking at, symptoms and bleeding, that's the two things I look at when I do a
Okay.
pulpotomy. Based on the symptoms, obviously, if they had pain and all of a sudden the pain is gone, it's probably not the most vital pulp. So it's kind of either going towards necrosis or, irreversible pulpitis. So that's one part of it. And then I look at the bleeding actually within the chamber. So once I get into the chamber, if I am doing more than one pulp, I'll compare bleeding. And obviously if it's not matching and one is like excessively bleeding and kind of just flooding up
Yeah.
like lava in a volcano, then at that point I'm like, yeah, that's not a healthy pulp. You could always do a pulpectomy. It all depends on cooperation. It depends on patient's expectation, parents' expectations. And that's when I started leaning towards that extraction. Whereas if the pulp is under control, the bleeding is under control, I got my materials, my products are under bringing this bleeding under control, then I probably will go ahead with the pulp and then finish with a stainless steel crown. In terms of tips for pulpotomy and stainless steel crown, I mean, I do my occlusal reduction right off the bat, which
Oh,
gets rid of
good.
half the tooth,
Yeah.
so that your pulp is a lot easier. You're a lot more, it's more visual. You don't have the cusps obstructing your angles of the burr. So the pulp quality and your technique will be a lot faster and a lot more efficient.
And then for your actual pulpotomy,
Yeah.
for your cotton pellet, what do you dip it in?
Honestly, I've read it all. So it used to be formal for me, which was way
Yeah.
back when. Then the whole, concerns about formal came up, so I started
Yeah.
using ferric sulfate. But then after ferric sulfate, I read some articles about that. So now I'm more about either sodium hypochlorite, saline, or a hydrogen peroxide mixed with water.
All right.
Read procedures about all three of them. To be honest, it's just about controlling the bleeding at that point.
Okay.
So cleaning and disinfecting is not the end of the world at that point. Our goal is to bring the bleeding under control. Some people just take a dry pellet and put pressure and hold it there.
Yeah, I do that.
Yeah, I put it some saline if I have some saline, otherwise sodium hypochlorite or hydrogen peroxide mixed with water, diluted with water. And I just leave it there, go do the other tooth if I have a, composite restoration. So I'm starting to prepare for that. And then I'll go back, I'll use a dry pellet, put some pressure, make
Okay.
sure the bleeding is very minimal to almost none. And then I'll put my MTA.
Good. So you use MTA? How about if
Now
an
I'm
office doesn't have MTA? I use MTA now because of you as well. But
yeah.
what if an office doesn't have MTA? What can they use?
At that point, I mean, listen, if you've controlled the bleeding, you need something that's gonna fixate the bleeding. So that's where the formal and the ferric sulfate came into play. Some people don't even use either and just do like the step I said, and then they put IRM or ZOE in there in the
Okay.
chamber. Studies have shown that that works. For me, I went with the highest success, and I think
Yeah.
MTA has 95% success. So I'm like, you know what? It's that expenditure that I will think will benefit the child the most. So if you're cutting, costs somewhere else, do it somewhere else, but
Yeah.
go for the MTA. MTA is probably like I've knock on wood seen the most success with in the last 3 years that I've been using it.
And I like your tip on Instagram where you just use a little bit of MTA because it's expensive and then you put the IRM over it.
Yeah, because all you need is the barrier, right? It's not about filling the chamber, especially if you're doing a crown. You're
Yeah.
going to provide the strength of the tooth with the crown. So no
Okay.
matter how hollow the inside is, you don't need a cement MTA to fill the
Yeah.
chamber and make it strong. You don't need a core. You don't need any of that. You just need the canals to be blocked off so that there's no transmission and leakage of bacteria.
Yeah. And speaking of leakage, that's why you don't put composite over the IRM or
Yeah.
MTA because it's not going to bond to it.
Yes.
So stainless steel crown, if they don't have a stainless steel crown or not confident placing it, what can they use instead?
Oof. Uh, I
There's
mean, probably an
amalgam.
amalgam is better than a composite at that point. An amalgam is definitely better than a composite. The only thing, okay, so my only concern with amalgam and composite intracoronal fillings or
Yeah.
treatments are that you've just hollowed out this tooth, and
Hmm.
a pulpotomy on a primary tooth leaves a lot less strong tooth structure than a pulpotomy on an adult tooth. So on an adult tooth, after a pulpotomy, go ahead, put a filling, put an amalgam. You still have strong walls all around. On a primary tooth, if you look at your pulpotomy procedure, don't just focus on the pulpotomy, zoom out and look at the thin wall of crown left, right? So putting a filling on there and creating those wall pressures, eventually it will fracture,
Okay.
and that's why I try to avoid fillings at all costs. And that's what my goal is. My goal is through my Instagram and through my courses is that I want to teach dentists that stainless steel crowns will be faster than a composite filling, less
Yeah.
technique sensitive, less moisture concerns, way better success, and you don't have to have the crown look as pretty as maybe my crown after 10 years.
Yeah.
You can it's a lot more forgiving than a composite filling is.
Yeah. So I use stainless steel crowns on kids if after I do pulpotomies or if
Yep.
it's more than a two surface restoration. And
You are
yeah,
doing by the book.
oh my gosh. You're like, you just told me that like I'm doing the right thing, so that's good,
You
but
are you are.
but I wasn't confident using stainless steel crowns at the beginning. So what I did was I started practicing on typodonts and then I got good on at that. And then what I did was I picked like a 9-year-old, very cooperative. I did it on a primary molar. So I knew that if I screwed up and I had to extract the tooth, she was going to get a new tooth in a year anyway. And then that's how I built my confidence, like case selection.
Yep.
And then now, like you said, yeah, it's so much faster than doing a restoration.
Yeah, yeah. And honestly, like you said, case selection. I always say if you want more success, you just need to choose the right cases.
It's
If
true.
you walk into the wrong case, no, like there's no dentist out there that can get it successful. So why are you hard on yourself? You chose the wrong case. We're all gonna fail at it. So choose the right case and you'll have 100% success. I definitely think starting off, yes, 8, 9-year-olds or cooperative, even 7-year-olds,
Yeah,
with a little bit of laughing gas, and you can get it done even if it's one single crown. Start with a single crown, then work side by side crowns, then work certain teeth are much harder than other teeth, like
yeah,
D's, upper D's versus all
yeah.
the other teeth. So perfect way to go about it. And honestly, if you don't do it, you'll never gain the confidence. But once you do it, I can guarantee you will say, oh my God, that was so much faster than a composite. You will look at your post-op x-rays over the course of 6 month, 1 year recall, and you will see more success, 100% more success.
Oh, good. Now, when you were a new pediatric dentist, what type of things did you struggle with? Not just clinically, but other things.
Oh, lots. Okay, well, I'll start clinically right away first, but adult teeth extractions. So during dental school, we did extractions with the oral surgery residents, and you took out perio involved teeth, not healthy,
They only let
sixes
you
or
take out
sevens.
like the M3s.
Yeah, that's it. Exactly. Like now I can take that out with a hemostat, but back then you got the whole forcep, the technique.
Yeah,
So yeah,
exactly.
no, definitely that was my biggest fear going out of dental school. And then you see kids, and to be honest, I only saw kids from that point on, right? So I have not seen an adult since 2012.
Okay.
Um, for me, yes, maybe doing a second molar extraction on a 20-year-old will still be a little stressful.
Yeah.
But I just went out there and started doing them. So when I was in Rochester, I was still a little scared, still a little worried, but I'm like, you know what? I just got to do the easy, like you said, do the easy ones
Yeah.
first. So I saw whole crowns, just hypoplastic or
Yeah.
pulp involved. The parent didn't want a root canal. I'm
Yeah.
like, this can't shatter. It's got so much strength. And I just started seeing, okay, what is making it crack and what's not making it crack, and then kind of working my way up. Now I'm definitely way, way better than I was in 2012 in terms of like fear, anxiety related to adult teeth. But still, it gets me a little bit. When I see an adult tooth extraction, I'm kind of like, okay, I got this.
Good.
But definitely came a long way. Still not where I
Good.
want to be, but definitely came a long way. Other things I struggle with, I mean, whew, okay, let's get into it. So, when I first came out as a pediatric dentist, any graduate, I think, even out of dental school, you have these expectations of your career and your life.
Yeah.
You chose dentistry for a certain reason. My reason was lifestyle. Since I went into dental school, I told myself, or even before dental school, I was like, I want to choose a career where I can still have a life outside my career. I want to spend time with my family. I want to enjoy the world. I want to have work-life balance. So I always heard that phrase and I always told myself that's what the life I want. Um, so I chose dentistry. And then when you come out of dentistry and you start practicing, I mean, you come out of dental school, you start practicing dentistry. That's when you realize that sometimes you take your work home into your
Yeah.
life. So I started realizing that I was doing that. First year was fine. Second year was a little bit. Third year was more. Fourth year was a lot. So in my third and fourth year, I was kind of struggling with that where I was leaving work. And if I got an email after work, my mind was running and it was always spiraling towards the negative thoughts. It was a lot of anxiety, it was a lot of stress, it was a lot of overthinking, but towards the negative aspect of it. Never saying, oh, that patient probably emailed to thank me, or a
Yeah.
patient probably emailed to ask me a question about when can they eat pizza again. No, it was like, oh my God, the kid's in the hospital because the abscess came back, like I left a piece in there. Oh my God, did the stainless steel crown fall off? Like it was always the most negative thoughts. So that made me kind of almost say, okay, well, it's no longer a work-life balance. Yeah, sure. Maybe I'm working 4 days a week, maybe I'm working 5 days a week, and I have my weekends, but even on my weekends, I'm thinking about Monday. I'm thinking about what happened on Friday. And that's when I realized that, you know what, maybe I need to accept this and take a step back. I thought the best way to do it was to if you don't go to work, you're not going to stress. So I went from 5 days to 4 days, four
Okay.
days to 3 days.
Okay.
And then I kind of found my happy medium where I'm like, okay, 3 days of stress, 4 days of forgetting the stress, and then I'll go back on Monday, a much better person. So for the first year, I did that and I said that was good. And then I realized I'm like, you know what? This is starting to affect my friendships. This is starting to affect my mood when I'm hanging out with family. This is starting to affect my relationships. I'm on edge a little more. I'm stressed out a little bit more. Even when I'm going to work out, which is supposed to be my happy place,
Yeah.
I'm still looking up stuff, reading emails. I'm not able to control that thought process.
Yeah.
So that's when I looked into therapy. So
Good.
I started therapy about 2.5 years ago. I still do it occasionally. It's a little bit less common for me to do it every month, but before that, it was like once or twice a month. I was going virtually during towards the end of the pandemic, and it was a therapy not just to talk out my problems, but I actually wanted to solve the problem. I didn't
Good.
want to just talk. I wanted to change the way I think, because it's not just about dentistry. I wanted it not to carry on into other
Yeah.
aspects of my life. So yeah, I learned strategies. I did some cognitive behavioral therapy where, you start spiraling, but how do you control those thoughts so that you can kind of guide yourself towards a better mood, a better day, a better, thought process, not affecting other aspects of your life, and learn a bunch of strategies. Now they're pretty much just implemented into my thought process where I see myself going down there, but then automatically the systems kick in
Yeah. Like you
and they do
changed
the job.
like your mindset.
100%. Yeah.
That is awesome. I love that you admitted that you were struggling, that you realized you needed help and you
Yeah.
got help because what piqued my interest to connect with you is like during those webinars you did during the pandemic, you had a giant picture of Buddha behind
Yes.
you.
Yeah, it's right there.
And I have a thing for Buddha. Like I
Yeah.
swipe right for him.
Yeah.
And because like he represents peace. Like you have to have internal peace.
Yeah. Yeah.
And it's
Anything in life, like it's not just dentistry, everything is going to cause you stress. There's no shortage of stressful situations in life or life that, will affect you beyond the event, right? And I just like we all talk about work-life balance. We talk about, I want to have that life balance. But then if that life is a dark cloud, for
yeah.
me, it's just okay, work and then sad, or anxiety or stress. So where's the life part of it? I saw life as a sunny day, bright day, and I couldn't find that. And I think even through like we're talking about Buddha, for me, it was just more, I want to be a healthy individual mentally in my relationships, in my friendships, family, work, just all aspects of it. And I think that's the part that was missing where I was like, work, I'm doing well. I did great
Oh,
stainless steel crowns. I'm doing good treatment. I'm behavior managing. These patients are cooperating. But then that 25% that was causing me anxiety was affecting the rest of my life. So
yeah.
something had to be done. Yeah.
Yeah, like you were telling all these amazing stories to your patients, but the story you're telling yourself was, I screwed up,
Yeah.
my treatment's not gonna work. So yeah, like you
I'm
have to
not a good
that
pediatric
yeah,
dentist.
exactly.
Yeah.
That imposter syndrome, like I was the
Yes.
same way where I was saying negative things to myself all the time, like, oh, this is, I'm a crappy dentist. I
Yeah.
don't know what I'm doing. I can't even get like a matrix band on and like that. And like yesterday, I saw a patient where I recently did crowns for him last month on his front teeth, and I saw him sitting in the office first thing, And the first thing I thought was, "Oh, crap. His crowns broke. His crowns came
Yeah.
off. He's not happy with them." Meanwhile, he was there for a cleaning. He's
Yeah.
like, "How did my mind go there that I did something wrong and that's why
Yeah.
he's there?"
Yeah. That's the
So
first thing we
I'm
think
still
about.
working on it.
Yeah. And that's the first thing we think about. And to be honest, like I learned that your emotions will happen regardless.
Yeah,
Don't try to control your emotions. It's the thoughts and the actions that come after that that you do have a little bit more control over.
yeah,
So accepting is the
yeah.
first part. Like you said, accepting that I was struggling is something that was the hardest part because when I was going through this, nobody was talking about dental anxiety as a profession.
Ah,
Nobody was really, there was no Instagram posts about it. Now it's all over social media. Medical professionals are talking about it, dental professionals are talking about it. For me, it was just kind of like, I can't even say this to my friends because my friends all say their jobs are good, they're practicing, they're working
ah,
5, 6 days a week, they're increasing their days. And here I am trying to cut days because I'm stressing out, I'm feeling anxious, I'm feeling sick, like so there's no one to talk about it. And then I realized I'm like, you know what? If I don't talk about it, nobody's gonna talk about it. So I just said it. I just said it out loud. I said, I
yeah,
think I'm gonna cut my days down. I'm not happy. And then more people started talking about it. And then I
yeah,
realized that it's not just me. There's a lot of people out there, but they're not looking for that solution. Or they haven't accepted it yet, that they have to look for a solution. And I remember one thing that my mom said to me, and obviously my mom's like, the Indian mentality, the hustle, the grind. And she said, you know what, when you're scared of something, you got to go more into it. So if you're
yeah,
anxious, go do more days at the clinic. And that's what I thought.
exactly.
I was like, okay, you know what? I'll go from 4 back to 5. And then I'm like, wait, hold on. No, I'm like, I don't want that advice because I felt like by adding more days, it was just causing me more
Yeah,
anxiety. And I thought, okay, sure, I'm trying to put myself more in the situation, but now I'm enjoying myself outside of dentistry even
yeah,
less. So I put
yeah,
that advice
yeah, you
aside.
realize, like,
I need to just find, I just need to find a balance. And that's how I got into Toronto was that I found a practice that would take me on for 3 days and then gave me another role where I did, admin stuff, clinical director stuff, recruiting, mentoring.
mm,
I started doing social media. I started doing those webinars and just handling the clinics from a non-clinical aspect, like a non-practicing dentist aspect and being compensated for that. So I'm like, oh, there is a career that I could do outside of just drilling and filling, and not just teaching or supervising at the university. So I'm like, okay, there are options. And that's how I kind of started finding multiple things to add to the picture. And I'm still in love with dentistry and
yeah,
oral healthcare. I'm just not going to be a 5-day clinician.
that's good. You realize what you want to do. And like, I think your mom was trying to say, like, you're hiding away from it by cutting back your hours. But she was like, you need to face it head on, which is what you did with therapy. And then you
Yeah.
found other things to fill those other 2 days,
Yeah.
which
Yeah. And
are
also
related
like,
to dentistry.
yeah, and also like you said, yes, facing the monster is only gonna reduce the fear. And I get that. And me, I was running away from the monster, so the monster was still big, it was
Yeah,
still scary because I'm not facing it. I just realized I'm like, the monster will be the monster. I just gotta go get all my other strengths in line so that if ever the monster does affect my life, I'm able to fight it, and that's where now I go in 3 days a week. Sure, there's moments of stress and anxiety. There's moments of where I'm like, that wasn't good enough treatment. Like, I gotta be better. Of course, there's hardships, but I'm also kind of like, okay, you know what? Today was today. Tomorrow's a new day. Tomorrow I'm working on my passion project of this,
yeah,
and I'm doing this and I'm growing this. So I'm like, okay, it's a good life. Like I'm happy, you can't run away. You can't have a life that is completely stress-free, is what I say.
yeah,
So
that's
there's
true.
always going to be something, whether it's in this, you can look at every career and I'm passionate about oral healthcare. Am I passionate about drilling and filling? No, but that's okay.
Good. Dr. Nick Sharma, pediatric dentist, the Buddha of dentistry. Tell us how we can find you. Tell us about like upcoming presentations you have.
So, I mean, I'm on Instagram under Dr. Little Smiles. So that's for like patient education, oral healthcare education. So definitely follow me on that for pediatric and all oral healthcare knowledge. But then I also have a page that is just for dentists, and I want to just give tips and tricks about pediatric dentistry. So definitely a lot of general dentists on that, and that's just at Dr. Nick Sharma. So Dr. Nick Sharma. Yeah, so you can find me on Instagram, that's for sure. But I am doing workshops and courses as well. So I'm going to have an online course as well as a hands-on workshop. And yeah, you can find out all the details through my Instagram. And definitely reach out to New Dentist Club and Sanj for any questions, and she'll put you in touch with me. But we will have workshops in the Greater Toronto area for general dentists to just feel more competent, comfortable, and confident when it comes to treating kids.
Thank you so much, Nick. So follow at Dr. Nick Sharma on Instagram. And thank you everyone for watching on YouTube, for listening on Spotify. You can follow us on Instagram at New Dentist Study Club, and stay tuned for our next episode with Dr. Sean Lim, oral surgeon at Oral Surgery Guy, where you're going to learn some tips on how to take out teeth. Thanks, everyone. Thank you for listening to the New Dentist Study Club podcast. Follow us on Instagram at New Dentist Study Club.